their life is directed. So I was wondering, what is Keenan's favorite quote?
My favorite quote ever?
Well, whichever one you like.
I mean, there's a lot of them. What is Carpe Diem? Is that seize the day?
Yes, that's seize the day.
That's a good one. But I've been getting a lot of friendship things lately through like my dad's been sending me a lot of stuff, and then people have been direct messaging a bunch of hey, you know what real friendship is? It's this and that and the other. Or a real man is somebody that when his feet hits the ground, the devil goes, "Oh Lord, he's awake." That kind of stuff.
Wait, let me read that one again. Okay, a real man is the kind of man that when your feet hits the floor in the morning, the devil says, "Oh crap, he's up." So what is it about that quote that resonates?
Just because, that's a man who's a positive force for just positivity, basically, and the devil is the exact opposite of that. So, it's just like, oh, snap, there's a giant enemy that's awake, and the force that's, going out in the world.
You know what's funny is because a lot of people in this time in our lives, this really strange and some would call it a pretty depressing time in our lives, they're having trouble staying bright, staying positive. What do you do to stay that way?
I mean, my kids help me with that a lot, just watching their innocence and their childhood growing up. They don't really know why we're all stuck inside necessarily. My 5-year-old talks about it, but I don't think she really understands. She's just like, "Oh man, coronavirus got us inside again." And I'm like, "Yeah, it's pretty important that we stay inside." And she's like, "No, man." But, between that and just being grateful, honestly, for being alive, number one, being healthy, and, just being around my family more, I can't complain about that necessarily. It goes to show me exactly how much I've been missing lately.
Yeah, and I bet your kids are probably loving just having you around. So how do you flex that creative muscle? I mean, you're a funny guy. Do you put on shows for the kids? It gets flexed in different ways. Like I try to entertain them, and then they go and show me exactly how funny I'm not. Instagram helps a lot in that kind of, social media and being able to reach out to them and exchange pictures at work or different video clips from backstage, or even just talking to each other has always been, in the attempt and so on and so on. So it felt really good to get back out there and present to the world what we think is funny. Well, we look forward to the day that you're back where you belong. And it was just great seeing your face. Love to you and your family, Keenan.
All right.
Thank you, Keenan.
Bye.
Bye,
Thank
babe.
you.
Have a good
Did
one.
It just get all fuzzy?
Yeah, we got all fuzzy.
You too.
Okay, nice talking to you.
Oh, we got all fuzzy.
Bye.
This Tuesday morning, several southern states are now moving to reopen.
By taking this measured action, we will get Georgians back to work safely.
Social distancing must continue. Our economic shutdown cannot.
South Carolina's business is business.
Georgia, Tennessee, and South Carolina all announcing they are easing restrictions. By the end of the week, Georgia's governor says businesses, including gyms and hair and nail salons, can all reopen. On Monday, theaters and restaurants in the state can follow suit. But bars, nightclubs, and amusement parks will remain closed for now. Governor Kemp conceding the move does not come without risk.
We're probably going to see our cases continue to go up, but we're a lot better prepared for that.
The mayor of Atlanta overnight reacting to the news.
I'm perplexed that we have opened up in this way. And as I look at the data and as I talk with our public health officials, I don't see that it's based on anything that's logical.
In South Carolina, they are loosening restrictions on public beaches and waterways while allowing furniture, jewelry, and clothing stores to return to business now.
If compliance remains at the high level that it has been, we can do this without endangering the population.
And in Tennessee, the governor declaring he will not extend his state's stay-at-home order beyond Thursday, April 30th, near the end of next week.
Social distancing works, and as we open up our economy, it will be more important than ever that we stay committed to that. Lives and livelihoods depend on it.
Those moves to get back to business come despite those states not experiencing a decline in COVID-19 cases for 14 straight days. A recommended criteria included in the White House's benchmarks for reopening. Dr. Deborah Birx acknowledges they're just guidelines.
Each of the governors can decide for themselves whether they've reached specific guidelines in specific areas.
It all comes as protesters from several states demand their stay-at-home orders be lifted.
Let people go back to work. It's time.
From the coronavirus epicenter in New York, Governor Cuomo responding to those mounting frustrations.
You don't need protests to convince anyone in this country that we have to get back to work and we have to get the economy going and we have to get out of our homes. Nobody.
All right, Tom, let's talk a little bit more about that overnight tweet from President Trump. He announced that he'll suspend immigration over the...
Well, the White House says this is really about protecting American jobs. Again, we've got more than 20 million jobs lost over the last month or so. However, it is important to note that for the most part, immigration has already come to a screeching halt in this country because the borders are, for all intent and purposes, closed. An application process has already been suspended for weeks.
Well, and Tom, another big story we're talking about in Washington. Congress is working on another interim coronavirus bill. A lot of small businesses are desperate for that money. Where do things stand?
A little bit of a hang-up right now in Congress. Democrats say they want to see more money going to hospitals as well as small businesses, state and local governments. Now, for Republicans, giving more money to state and local governments is a bit of a hang-up. Some governors have been pleading for federal money, including Governor Cuomo out of New York. So we'll see some movement on Capitol Hill. It got hung up a little bit yesterday. We'll see if there's progress today.
All right, Tom, you'll keep your eye on that. Thank you.
This morning, as calls to reopen the economy intensify, many states are frantically ramping up coronavirus testing. There are two kinds of tests: diagnostic, which tells you if you have the virus, and antibody, which tells you if you've had it. In hard-hit New York, health officials are starting antibody tests on 3,000 residents with possible immunity and to see how far the virus has spread. Over the past few days, New York City has opened walk-up testing sites. Many drive-through sites in the state say they're at capacity.
Well, definitely we need to be able to test more. We need more resources, personnel.
So far, New York State has conducted the most tests in the nation, more than 500,000. But Governor Andrew Cuomo argues that's not nearly enough. He says public and private labs can buy testing machines from manufacturers, but they also need what are called reagents, chemicals that interact with patient samples. Those reagents are often made in China, and right now they're in short supply.
I don't know what's right or what's wrong with that national supply chain question, but that's where the federal government could help.
President Trump says he'll use the Defense Production Act to increase the production of swabs, but he believes it's up to the states to do the testing. He argues there is enough testing capacity.
Not everybody believes we should do so much testing. You don't need so much. The reason that the Democrats and some others may be because they want maximum because they want to be able to criticize.
Maryland's Korean-American First Lady worked with her native country to get 500,000 tests. Her husband, Governor Larry Hogan, says it shouldn't be that hard.
Why we haven't made more progress on testing, I'm not sure.
Serious issue? Experts say these new tests are not perfect. Oregon's diagnostic lab says 70% of the rapid tests his team tried to validate gave inconsistent results.
It might give people a false sense of security that they somehow have immunity.
Some experts say the U.S. would need to do 1 million tests a day to feel confident that the outbreak was contained. Right now, that is roughly what the country does in a week.
Sets us up for Dr. Margaret Hamburg, who served as FDA commissioner for nearly 6 years under President Obama. She also oversaw diagnostic testing of both Ebola and H1N1 in that capacity. She also once served as New York City's health commissioner. Dr. Hamburg, good morning to you.
Good morning.
Before we get into the testing issues, I'm hoping you can break those down for us. Let's talk about the reopening, partial reopening of some states. We've heard about South Carolina, Tennessee, in Georgia. They're even going to allow, nail salons and gyms and tattoo parlors to reopen. Have a thought about the wisdom of that?
I am surprised, as was noted in your earlier story, some of these places are not even meeting the minimum threshold criteria that was put out in the Trump White House coronavirus task force guidance. We don't know enough about how the virus has penetrated their communities and their states. We don't know about the possibility for spread of the virus as people go back into these social gathering settings, the workplace, schools, whatever, so that they will think carefully, I hope movely, and certainly they need to have in place adequate testing capacity to identify those who are infected, make sure they're isolated and not spreading to others, and be able to use public health measures of contact tracing and quarantine. To better surround and protect against ongoing spread.
Well, let's talk about this testing issue. It was just laid out fairly nicely. Before we get into the breakdown of what's going on here, how much testing really, in your opinion, needs to be done? I mean, there's reports that we do about 150,000 tests a day in this country, diagnostic tests. What's the right number? What's the ballpark?
I don't know that there is any right number. Certainly, many people who have looked at this think we need to be doing somewhere between 3 and 20 times as much daily testing. And it will vary in different regions of the country. One thing that is clear is that of this novel coronavirus epidemic in our country, we have been behind where we should be in terms of testing, and that has made it really hard for us to fully understand the nature and scope of this epidemic. And so we need, even with everything else that's going on, we need to have a flat out, all hands on deck effort to be able to expand testing availability, quality. We need more rapid testing because in some places, as I talk to health commissioners and hospital CEOs, healthcare workforce, many tests, unfortunately, are being quite significantly delayed. And you mentioned about the shortages in swabs, and that was a problem we saw coming. We cannot let it now fester. We have to really mobilize and address it. And it's going to be hard. And as Governor Cuomo said, we really do need the federal government to help spearhead this effort so we can get what's needed in terms of tests and the tools to do those tests and get them where they're needed.
Well, we